Welcome to our Q&A session where we are going to talk around the COVID vaccinations. And we're fortunate today at RAC to have Professor Andrew George and Professor Katie Urch, who are going to answer some of the questions that we've had from our learners who have watched a film that both Andrew and Katie recorded explaining all around the vaccines, their origin and all the learnings that we've had to date. And we've also had some questions coming in from the public. So this afternoon, we're going to do a short Q&A session that you can view at your leisure. So over to you, Andrew and Katie. Perhaps you'd like to introduce yourselves first.
Certainly. My name's Andrew George. I'm an immunologist as background. I also am involved in the regulation of research in the NHS, and I'm also chair of RAC. Katie?
Thank you very much. I'm Professor Katie Urch. I'm a consultant doctor and I'm at the hospitals St Mary's, Charing Cross and Hammersmith in North West London. And I am not only a medical doctor, but I also am involved in clinical research ethics. So in other words, giving permission for clinical trials to go ahead. Thank you.
Great, thank you very much. So we showed your really interesting film to our learners in class, and particularly two groups of learners, our adult learners with learning difficulties and disabilities. Some people call them SEND learners. And we also had our ESOL learners also view the film and send in some questions. So we just thought we might just first of all do a piece for our SEND learners just to explain some of the questions that they had and that you might be able to answer for them. So one of the first questions was, will the jab hurt and will I be sick from having the jab?
That's a very common question by many people. So having this vaccination is no different from having any little injection. The needle is incredibly fine. Most people don't even notice when the needle goes in. So I would say having the vaccination, no, it won't hurt. Will you get sick afterwards? All vaccinations and all medicines can have side effects, and some people do find they feel less well afterwards. Sometimes their arm hurts, sometimes they get a headache, sometimes you might just feel very tired. Some people have a little temperature. Usually these are very mild and usually they all have gone away in a couple of days.
That's fine. And then another question was, what happens if I do not want to get a jab?
So what happens? Nothing happens. We would keep encouraging you and really would like to chat to you about why you might have some reservations, or perhaps you've got some more questions, or you might be a bit worried whether you can have the vaccination and your medications. And so we'd really encourage you to talk to your GP or talk to one of your carers and really explore some of your fears and reservations about that. The reason why we want you to have a vaccination is really to keep you safe and to keep you well. And the vaccination will keep you safe and keep you well from getting very severe COVID. And many, many people, unfortunately, have died from this disease, and we really don't want that to happen to anyone else. So that's why we would encourage you and help support you in getting a vaccination.
Thank you. And how many times do I need to have a jab?
That's a really good question. So what we do normally is give two doses of the vaccine, so 2 jabs, somewhere between 1 month and 3 months apart. And that's really to wake up your whole body and your immune system and get ready to fight. And then the second jab is really to give it that extra boost and make it very, very ready to fight the infection. But then, as with everything, if we wait some time, many, many months, everything a bit goes to sleep and we stop being quite as on form of fighting the infection. And so now we're recommending a 3rd injection. So at the moment it's 3 jabs, but I think it's going to be a bit like flu, and that every year they'll come around and we'll be asked to get a little reminder jab to wake up our immune system again.
Great. Thank you, Katie. I think there were also some other questions from those learners that we're going to wrap up into some of our other questions, which I think would be really helpful. So another question that we've had, and I'm sure you've heard from lots of people, is I'm concerned about the long-term effects of the vaccine. There's no information on this and how I can be certain that it's safe.
So you're right. So the long-term results that we have is only as long as the vaccine has existed. And that is really just coming up for a couple of years now. That is not a very long time. However, we do know a huge amount about vaccines. And I'm going to ask Andrew just to talk a little bit and remind us about the hundreds of years that vaccines have been around. So we do have quite a lot of information about that. We do know an awful lot about the short-term side effects, the things that I've talked about immediately. People might feel a bit sick and headachy and fluey. And we do know some very, very, very rare complications around the inflammation of the heart or some clotting disorders that happen both with COVID much more commonly or with the vaccine much more rarely. What's very interesting in all of these seem to be self-limiting. So in other words, they occur quite quickly after you've had a vaccination, and then they do not seem to have long-term side effects or consequences. I think it's always worth remembering why we're suggesting get a vaccine. And the vaccine is because the disease itself is really very dangerous. We've had hundreds of thousands of people dying. We also have many hundreds of thousands who are left with long-term consequences of that disease. And they affect all age groups in all the countries. So really what we're trying to do is say, we don't want you to be ill in the short or the long term from the disease. We want to try and protect you. You're absolutely right in doing that protection. We do awake your immune system and make it pretend it's fighting the infection itself. And there are some side effects. Luckily, we are not seeing the same long-term side effects that we had before with the disease. But Andrew, would you like to tell us a little bit more about vaccinations and why they're safe?
Yeah, thank you, Katie. Well, I think one of the things, and while we don't have many years experience with the COVID vaccines, we have hundreds of years experience with vaccines, smallpox being the first, and then going on to many other vaccines that have been used. And I think it's worth remembering how vaccines work. So how vaccines work is that you inject a small amount of something that stimulates the immune response. As we discussed in the talk, for the COVID vaccination, it might be a bit of a virus that normally causes a common cold that's been altered to make it express a little bit of the COVID, or it might be some RNA. And these things do not last in the body very long. Their task is to actually stimulate the body's own defense mechanisms, the natural defense mechanisms that we have against disease. And those are what kick in. So in actual fact, months, weeks after the vaccine has been given, there won't be any of the vaccine left. What will be left is the natural immune response. And so actually with other vaccines that we've had for all those many years, we do not see a long-term effect of vaccines in terms of side effects. You do get the short-term side effects that Katie's talked about, but you don't see the long-term side effects. The vaccine isn't there after a few weeks or months. It's gone. All you've got is the natural immune response against the infectious disease.
Great, thank you very much. We know a lot of people have sent in questions to us around fertility and whether or not the vaccine can affect fertility either in teenage girls or mature women. I wonder if you could give us some feedback on that.
So I'll start, and again, I'll hand over to Andrew, but just how the vaccines work. So the simple answer is it has absolutely no effect at all on fertility. So what makes us fertile are cells, obviously, that are growing in our ovum, our eggs, or sperm in men. And in order to get to those sites, it's incredibly difficult. They are very, very well protected by the body. And so it's very hard for anything to affect, per se, fertility in us. So the vaccine itself is just stimulating a natural immune response. As Andrew said, it doesn't hang around, it's not there, and it certainly cannot get through in any shape or form into any of the areas that are governing our fertility. So it's really important to remember this does not affect fertility. It is not there as contraception. Please do not use it as such. And many, many people are pregnant very successfully with happy, healthy babies having had a full vaccination. And on that, we do more than just say it's nothing to do with fertility. It's really vitally important, if you are thinking of having a baby, to become vaccinated so that you and your baby are protected from the COVID infection. Andrew, vaccinations, can they affect our fertility?
It's really interesting, Katie. I mean, down in history, there have been various times when people have campaigned against vaccination. And whatever vaccination they're campaigning about, this fertility is often mentioned. And yet there's never been any evidence of any vaccine against an infectious disease causing a reduction in fertility. And as you said, it's very difficult to think about how biologically that could possibly happen. As you say, the cells involved in fertility, the organs involved in fertility, are actually shielded from the immune system, and there is no way that the vaccine could get there. So it's implausible to think of a mechanism by which this could happen.
Thank you. And then going back to the point about pregnancy, Katie, some people are worried about having the vaccine if they're pregnant. So could you tell us a little bit more about that?
Yes, and of course this is very natural. When you're pregnant, you are really very concerned about what's going to or might affect the baby. And so there has been a lot of very specific work and looking at this vaccine, the COVID vaccine, in pregnancy. The good news is there have been several hundreds of thousands of pregnant women who've now had the vaccination at all stages of pregnancy, and there has been absolutely no effect, thank goodness, on the fetus, but a much healthier mother at the end of it. There is obviously some concern with many women about having a vaccination in the very, very early few weeks of pregnancy, often before you even know you're pregnant. And that's very understandable, and no one would force anyone into that stage. What we are all seriously recommending is every single pregnant woman becomes vaccinated in that middle trimester, between about weeks about 10 to 12 and about to weeks 24 to 28. Really important, because it's in the final trimester, when you're really big with the baby, that the trouble starts. And the trouble starts if people catch COVID during that late pregnancy stage. They can become very ill. People who are very ill often need to be ventilated. And part of ventilating them, we need to turn them on their tummies. Very pregnant women, unfortunately, we can't take a deep breath in because the baby's occupying the space. And so we can't ventilate them as much as we need to. And we absolutely can't turn them onto their stomach to help that ventilation. So I personally have seen several cases where we have had to induce and take the baby out early, much, much earlier than we would want to, in order to try and save the mum's life. And unfortunately, I've also seen several cases where the pregnant lady has unfortunately died from COVID, leaving a very premature baby behind. So a tragic, tragic consequence of a totally preventable death. And so the plea and the beg from every single person involved is that pregnant women, please get vaccinated. Do that to protect yourself and your baby, so that you'll end up with a healthy mum and a healthy baby at the end of your pregnancy.
Thank you. Other question is around people that are immunosuppressed and the impact of the vaccine on them and whether they should have it, how that affects them.
Yes, so I'll hand over to Andrew to talk a little bit, if I could, about how the vaccine and your body responds if you're immunosuppressed to anything like a vaccination. But from a medical side, I think immunosuppressed people, we would absolutely recommend you do have the vaccination. But I think the caveat is that very often the response you manage to make to the vaccine, in other words, can you mount a proper response to try and fight the infection, is reduced because you are immunosuppressed. So in other words, you've slightly turned off your immune system, or we've turned it off for you. We would recommend that you discuss this with the doctor who is looking after your underlying condition, who's giving you the drugs that are making you immunosuppressed, and really talk fully with them. There may be some points in the cycle of your drugs where it's better to give the vaccination than at other points. Sometimes people with immunosuppression, we need to give multiple doses to try and catch up and really trigger your individual immune response. So please talk to your doctor Please get advice about when is best to have the vaccination. But in principle, yes, we would very much encourage immunosuppressed people to have the vaccination. Andrew, could you talk a little bit about why that might be a problem?
So when you're immunosuppressed, you clearly, as you said, are unable to mount the full immune response that you normally mount. It's harder to mount the full immune response that you can. And that's why you might need more doses. You might need more doses in order to get yourself to the level that somebody who isn't immunosuppressed can reach after just 2 doses. But you can normally still mount a degree of immune response. And it's clearly important that you do, because if you are immunosuppressed, you're more at risk of infectious diseases, including COVID, as you'll be, as anyone who is immunosuppressed will be well aware. So in terms of the vaccine, there is no reason to think the vaccine does still work in immunosuppressed people. It just doesn't work as well. And that's why you might need multiple doses, and you might need to think about the timing of it, as Katie discussed.
And one of our questioners said, actually, could it damage the immune system if it's already suppressed?
No, not really. There's the suppression of the immune system is caused when you're immunosuppressed by other things, depending on why you're immunosuppressed, what the drugs are, or what the condition is that's immunosuppressing you. Remember, what a vaccine does is it stimulates your natural immune system to fight a particular agent, in this case COVID. There's no reason why this would damage the immune system at all. It's what the immune system does and is designed to do.
Great, thank you. So some other questions just around, the impact of the virus on different people. Why do some people have symptoms and others don't?
A fascinating question, and actually, Andrew and I have discussed this a lot. As with any infection diseases, and COVID is no different from many other infections that we have, some people become extremely unwell, and some people shrug it off and don't even realize they've got an infection. We only have to think of influenza and flu, or you could think of the common cold. You can be with people at the same event. Some of you get terrible, terrible cold afterwards, and other people don't get anything. And it just comes down to so many different factors. It comes down to, in COVID, perhaps how much of the virus we end up breathing in any 1 second or minute. So that's what we call exposure, how much virus actually is taken into our body. There's also so many factors in our body itself of how have we seen the virus before? Are we ready to fight the virus? In which case, perhaps with a vaccination will mean that we don't even let it get a hold. We're out there battling well before, so we don't get any symptoms. Other people just seem to be able to mount a really effective response really, really quickly, and so just don't have any symptoms. And the prime example of that is, of course, children. We see very, very little symptomatic disease in the younger the child, the less symptomatic they tend to be. And the older the people are, the more symptomatic they tend to be. And that is just probably a nature of which bits of the very beautifully complex immune system get turned on at any one time. But it all comes down to the wonderful rich variety that we have in humans, that we respond to our environment, to diseases, to infections very individually. And I think that's probably why. But we do know about 30% of people who we know are infected with COVID have absolutely no symptoms at all in any shape or form. And if you're vaccinated, of course, that goes significantly up to more like 80 or 90%. You won't have a symptom of COVID. Andrew.
Yes, I don't have a lot to add. I think some of the background, of course, in that mix of factors that you talked about, Katie, I think some of it may well be genetics. Our genetic makeup may well, we don't understand that well enough, but there is some evidence emerging around genetic susceptibility to it. And there is also, I think, on the wider scale of things, if you don't just think about the individual, and I think everything said about the individual is right, on the wider scale of things, when you talk about communities or people, there are also social issues, socioeconomic issues that also affect your risk of getting it, your housing, the proximity that you have to live and work and travel with people, as well as your underlying health and your underlying possibly nutritional status, for all we know. And again, there's probably not enough evidence for that yet, but in other diseases we would think factors like that were important.
Thank you. Sorry about that. My lights just went off. On that similar kind of theme, we've got somebody saying that they had COVID and recovered. So why do they have to have the vaccine and boosters?
Andrew, do you want to talk about how it wanes?
So I'll do that one. It seems that when you are infected with COVID, you do mount an immune response against COVID. That's normally why you get better. And that response does give you a degree of protection. However, and for reasons that we don't totally understand, actually, no, let me rephrase that one. For reasons because of the way in which the vaccine has been designed, the vaccine actually produces a much longer lasting immunity than natural infection does. So there's something about COVID as a virus that actual fact, the way in which it infects us, and there are lots of strains of the underlying the family of virus that we have, the coronavirus that we have. And it seems to cause a lot of infections in people, which last a short time. You get a short period of immunity for it. The way in which the vaccine is designed, where either the RNA vaccine, which goes into the arm, or the adenovirus, the cold vaccine that's got the small bit of the coronavirus in it, that seems to stimulate a much longer lasting immunity. And that's because we're hijacking mechanisms that are used by the immune system, the same mechanisms, for example, that you get with the influenza vaccine that produce this long-lasting immunity. And so the reason why you should get vaccinated is because you are likely to have a short-acting immunity through natural infection. You are much more likely to generate a relatively long-term immunity through vaccination.
Yeah, and I think we can back that up with quite a lot of evidence that when we test people's blood after a COVID infection, by about 6 weeks afterwards, most people have very few antibodies left to that coronavirus. So we don't quite know why it's so short, but it does seem that it goes away quite quickly. Whereas if you do the same set of tests for people after a vaccination, but like Andrew said, 6 months, 9 months out, you've still got good levels of antibodies around.
And as Katie says, we don't quite know why this is, but it might well be that the virus has evolved in order to not generate this long-lasting immunity, so it can be successful when infecting human beings. And what we're doing is we're breaking the natural history of the virus in order to give it that long-lasting immunity.
And what about those people that have been double vaccinated and are still getting sick with COVID?
Yes, and of course that goes back to that earlier question of why do some people get sick at all with the infection and some people have no symptoms at all, some people are really quite ill but don't need hospital, some people need to come to hospital, and about 5% of all people infected will end up in intensive care, and some of them will unfortunately die. So there's a range of reactions to this infection. And actually the same thing happens with a vaccination. Whilst it's good, it's very good, it's very, very good, it's not 100% and it's not a superhero. So we know that with nearly all the vaccines we have, about 80 to 90% of us are going to be really fully protected. Now we will still see coronavirus, we will still get infected with the coronavirus, and COVID will still be there. But actually our immune system's got a head start. So sort of waiting for the body to wake up and start fighting, it's right in there and it can start fighting the virus immediately. But of course, you then get a range. You get some people who fight the virus, get no symptoms, and it goes away and there's nothing. And you get a small percentage of people who see the virus, try and mount a good response, but they get symptoms. And there is all those variety of reasons why some people might get symptoms. And there's a small number of people who are, despite being double vaccinated, are really quite ill with coronavirus. I've yet to see them in ITU, that have to be said. The vaccine seems to be really, really good at preventing very serious illness and death, but we do still see people having quite a few symptoms. The patients I see in ITU nowadays are still the unvaccinated population.
Thank you for that. you mentioned about children actually earlier. So do you think primary school age children will have to be vaccinated?
That's a really good question. And at the moment, I think the jury is still out on that. So there are different considerations we need to weigh up. So with very older adults, if I could start at that end, it's very clear as older adults and individuals, they have a much, much higher chance of dying with COVID infection. So it's quite clear and quite easy. We can vaccinate that population. As we come down the age groups, the chances of any one individual dying from coronavirus gets smaller. It's not zero. There are plenty of 30-year-olds who have died from coronavirus, but it's much, much smaller than if you were 80 or 90. And that argument carries on going down all the way through to the ages. Teenagers are beginning to act in their response to coronavirus more like adults, not entirely like adults, but more like adults. They're teenagers. And so more of them will be symptomatic, but unlike adults, very, very, very few of them, hardly any, end up being so ill they need to be in hospital. But they still have a pretty awful time. So you might say, well, look, why would they be vaccinated? Because they don't get that ill. But then you have to realize what happens when they or a classmate gets coronavirus. They might not be ill, but they've missed school, they've missed socializing, all the natural growing up interactions and the freedom that they should be beginning to experience is actually what is really going to damage them. And we've learned so much in the last year of the terrible impact that actually keeping children away from each other, away from that social interaction, and importantly, away from education is really having. And that is going to be their long-term consequence. It might not be the long-term consequence from infection. It's going to be a long-term consequence of the impact of that infection on the rest of their lives. So that goes even further down to primary schools. And you can say they hardly get any symptoms at all. However, again, we don't really understand what the impact of staying away from school or being made to be frightened about interacting with other people, that they're at an intense age of really needing to explore the world and be with people and touch and smell and taste. And that is so important in their development. And it would be heartbreaking to think that for a vaccine, which no one has shown any consequences or long-term effect, as we spoke about before from the vaccination, that we may be driving a lot of harm into people by not vaccinating the children. But the jury is still out. We've settled on needing to vaccinate 12-year-olds and above because there's individually some benefit for them as a group, a huge amount of benefit. And actually as society, if we can stop them being a little sink of spreading COVID virus, it actually selfishly protects us much, much more, who are the vulnerable adult group. So that's fairly clear. There's 3 different reasons for vaccinating that group. Primary school children, I think there's still a lot more debate, not because it would be harmful for them as individual children, but because we're trying to weigh up any risks, any benefits for vaccinating that group of that age group. So I'm not about to pontificate on that. I shall wait for the JCVI to come out with that one.
Thank you. You touched on a point there around the vulnerable, protecting the vulnerable. We did have a question from a student, which was, why don't we just vaccinate the vulnerable and let the people who are at lower risk create this concept of herd immunity?
Andrew.
So it's an interesting ethical and actually also an interesting immunology question as to what's the best way to go. So one argument could be, let's only vaccinate people who are at risk and let's not vaccinate everybody else. And so we protect the people at risk. The problem with that one is actually quite difficult, firstly, to define who are the people at risk. As Katie said in answer to the last question, those who are over 80 are very much at risk. Those who are younger are much less risk, and everyone in between has a gradated risk. And so actually, where do you draw the line in that one? But there is also the problem that actually, even if you are at risk and you're immunized, you still have a chance of getting COVID. And while it has very effective at stopping serious hospitalization, there still is a risk of illness. And there is also groups of people who have not been immunized, or where the immunization has not been as effective as it should be. For example, the immunosuppressed group that we were talking about earlier. And one of the things that we have found in a lot of immunization campaigns is that it's far, far better to immunize as much of the population as possible to reduce the viral load across the population. And that's how you protect everyone, including the high-risk people. So yes, immunize the high-risk people, but also immunize everyone else to reduce that virus load. Examples, for example, are in the vaccines that are used to prevent cervical cancer, which originally were only given to young girls, but now we've realized, following information from America, data from America, that actually we need to give to girls and boys, because that's the best way of protecting the girls. So I think those are the main reasons why we need to really concentrate on immunizing everyone. But there is also a scientific reason that as an immunologist worries me, and that is that the best place to get variants that might escape from the vaccine, is in a case where you have a very high amount of virus in circulation and you have people who are vaccinated in that population, because then the virus will mutate as it tries to break into that population. And so I would like to see as many people vaccinated as possible to get the viral load down, so that we are less likely to get variants, and so those variants are then less likely to escape from the effective immunization.
Thank you. Can I just add one more thing, is that we've already seen some variants coming through. We've got the alpha, beta and delta variants. Yeah. And who we thought was at high risk originally, we've got new high risk groups emerging. So with the delta variant in particular, high risk people became pregnant women. And we saw a lot more very, very ill pregnant women with the delta variant than we did with the other variants. And so whilst we might say, oh, I'm not a high risk because I'm a healthy 20-year-old, actually, I don't know, the next variant, you might be the high risk group. So for Andrew's point, let's try and get everyone vaccinated, get rid of that viral load so the virus isn't circulating as much, and trying to break through our vaccination defenses.
And I think it's useful that you've mentioned that around the different variants. So how will we keep on top of it? How will we have to keep being vaccinated all the time?
So I'll hand over to Andrew about the scientific of how we're going to manage to keep on top of it. It's a really good question. In practically, because we do know new variants will emerge over time, and because our response into the vaccination does get less over time, it wanes over time, I think we will be vaccinating probably every year in order to maintain our immune system. But the scientists don't stop working, and they are always trying to fight and find ways around and treat the variants. Andrew, how are they doing that?
Yeah, so I think, I mean, I agree with your basic one. We don't know exactly how often we will need to be vaccinated, but I think once a year is probably a good guess, but it might be more, it might be less. So the variants are actually one of the really strong things about the platforms that have been made for making vaccines that we have. For example, the adenoviral vectors like the AstraZeneca, or the RNA viruses like the BioNTech, Pfizer, or other ones, is that actually it's relatively easy to change those. And so what they're a little bit like a cassette system. You have little bits of the vaccine that do different things, and there's one bit that is the bit that you want, that you're stimulating the immune system with, the immune system is recognizing, and that is based around at the moment mostly around the protein, the spike protein that the virus uses to invade cells. And that's the bit that mutates. And so as that mutates, what you can do is you can cut that bit out of a virus and put it into the cassette and change it relatively quickly. And so if you get a new variant, you are going to have to we may need to make new vaccines to that variant, but we should be able to make them much, much faster. And also we know now how the vaccines behave. We know how to grow up large amounts of the vaccine. And so that will even further compress the amount of time that it takes us to generate vaccines against variants. And some of these vaccines have already been made. And in fact, I've taken part in a clinical trial as a volunteer in which I've received a vaccine that may be a vaccine against a variant, because it's relatively easy to make them and they want to understand how these variant vaccines work. So I really, really hope that we won't get a vaccine that escapes from the virus. It is possible that we do. If we do, it's bad news, but it's not disastrous news, because we could fairly rapidly make a vaccine against that variant.
Thank you. What about having the booster? Does it matter what booster type you have? Do you have to have the same one as you had your first vaccinations?
So at the moment, the evidence says you can have anything with anything. There have been a number of trials done with people who've had the Pfizer vaccine first, being given the AstraZeneca second. There have been ones that we had, so I was Pfizer first, and I got given the AstraZeneca as a booster and following it. At the moment, it doesn't appear to make any difference at all. The only caveat is in our younger age group, we're still recommending they have Pfizer vaccine, just because of some very, very rare short-term side effects that were occurring in younger people with the AstraZeneca. And so they would always be offered either Pfizer, but it wouldn't matter whether they had Pfizer or Moderna or any of the other ones that the UK has regulated. So no, it doesn't matter. It will just go on your age and what's available.
Thank you. So one of our students wanted to explore about why some countries that have got access to vaccines seem to have higher rates of COVID than countries such as Africa, where they don't have as much access to the vaccines.
That's a good question.
Shall I tackle that one a bit, because it falls more within my field. So you've got to think about what causes an incident. Why do some countries have high COVID at this moment and other countries have lower? And there's several things that's going on there. The nature of the population is really important. So in many countries, for example, in the UK, there's a lot of mixing, there's a lot of traveling. And so there's been a large opportunity for the COVID virus to expand. Other countries, the populations stay more localized, they're often more rural, there's less chance for the virus to spread between people. And so those countries will anyhow have a naturally lower incidence of the virus. There are also going to be differences in demographics. So some countries, like in the UK, we have a fairly high proportion of our population are elderly, more at risk of the virus. Other countries have a lower population of elderly, including in Africa, because unfortunately they're at risk of other diseases, and as a consequence, you're less likely to get COVID deaths in those populations. Another variable is the extent to which we actually screen. In the UK, we have got probably one of the most extensive screening programs that exists, together with some other countries. That means we have a much better handle on how many people are infected. Other countries have a lower infection. And also, as anyone who has looked at the figures, for example, between regions of London over time will see, you will realize that there are hotspots that flare up and die down, and then another bit of London, another hotspot flares up and dies down. And so you've got to be careful that you're not just comparing a snapshot of one time against another time. And then, of course, there is vaccination on top of that one. And vaccination, we know, lowers, as you can see every night when you watch the news, lowers the incidence, has lowered the incidence of COVID infection compared to the peaks that we've had in our country. It doesn't stop it, and it also doesn't stop some rises happening in this country, indeed an overall rise happening in this country, because people are mixing, people are spreading more, there's more chance for the virus to spread. So all of those factors make it very, very difficult on a single time snap photograph to actually be able to understand why you're seeing differences.
Yeah, so I think that's really true, and it's important to remember that at the moment, so for example, in the UK, we have what we'd consider quite a high rate. We have at the moment 40,000 people a day testing positive. The vast majority, 80-90% of them are teenagers and school-age children, and we screen those children. If you went to Europe, you would not be screened, and therefore all those asymptomatic children, actually most of the primary school population, you would never know they had COVID because they don't bother testing. And you've got to look at what we test and who we test, and many countries simply just do not, they're not interested in screening and testing children, often even school children, unless they're symptomatic. And so if we did that, our rate, we would look very low. But we are just interested in understanding really what is this virus like circulating. And I'm afraid if you move to poorer countries with limited resources, they quite rightly have to make a decision. Do they put the resources into treating people and keeping them alive from many other illnesses, or do they put their resources into screening? And many of them will decide to put the resources into treating and feeding, not into screening. And therefore it looks artificially low.
And I suppose then that just makes all the comparisons with countries is
impossible.
Yeah,
it's impossible. So even if you look even to Europe, which you'd say, well, we're quite similar, aren't we? We're very close, we're very rich. But if you look at Germany and France, they just simply do not screen school-aged children. So their rates look incredibly low. We know in Germany at the moment they're having quite a peak of infections for a variety of reasons that Andrew's just talked about. And so now we're beginning to see the rise, but again, it's only in symptomatic people rather than as a baseline population screening. So it all goes on who gets tested and why.
What about people who are in frontline roles, including healthcare workers who are choosing not to be vaccinated? That's unsettled some people, hasn't it?
Yes, it unsettles a lot of us. I think first thing to remember is everyone, whatever their job is a human, and first and foremost, they have their own personal questions. They, just like people listening to this question and answer, they may have some concerns, they might have some hesitancy, they might have known someone who had a bad or a more acute reaction. And so there's lots and lots of concerns. I think it is unsettling though, because we're meant to know better. If you look in the healthcare profession, what we have found in our hospital is that the vast majority of people who were not wanting to have the vaccination at the beginning, once one offered them an individual chance to discuss what were their concerns, what were their reasons, why didn't it just feel right to them, we had over 90% of them then converting to have a vaccination. And so there's a large part of me which is about just trying to work with people and hear their concerns and their worries, and sometimes it's just convenience to make it easy for them, and they're all very justified. That's why we're keen to do these question and answers. That's why doctors are very keen to spend time talking to people who are worried about the vaccination, to see if we can encourage more and more people to have the vaccination. But first and foremost, we're human beings, and we sometimes have fairly deeply held views and beliefs. But what we're trying to do is give most people as much protection as possible.
Thank you. I think that's come to the end of our list of questions. I don't know if between you there's anything that you think we haven't covered that you would want to talk about.
I think the only thing that some people have said to me and asked me is whether there would be any impurities in the vaccine. Some people are worried about alcohol being in the vaccine, or elements that just perhaps religious, or they makes them feel uncomfortable. And I suppose it's just worth reassuring people that there's absolutely nothing in these vaccines at all. There's a bit of artificially made proteins, and that is about it. There's no alcohol in them, there's no animal products, they're not grown on fetal cells people are worried about. It's absolutely nothing like that. These are very sterile laboratories manufacturing proteins, and we give them chemicals to grow on, but there's not alcohol, it's not fetal cells, and it's not animal products in any shape or form in any way. So I just wanted to reassure people about that these are very safe and very sterilely manufactured vaccinations.
I guess my final words would be, the vaccine is really, really important. And as an immunologist, I really understand the difference that it can make in the fight against coronavirus, but it's actually only part of the fight against it. You know, it is not something that is going to mean that the coronavirus is totally over. We're going to have to learn to live with it for the next few years. And so actually, fact, even if you're vaccinated, you're still going to have to keep up good hygiene or hand washing, and being sensible about mixing with people in a way where you can still enjoy your life, you can still live your life, both socially and work-wise, but you are considerate to other people and live your and take care.
Thank you very much. That was really helpful, and thank you for spending the time to do this Q&A, so that hopefully people can watch that in their own time.
Thank you very much. Bye-bye.
Thank you. Nice to talk to you. Okay, I'll stop recording now.